doctor is in, and our doctor is here to tell us about an alarming correlation between vitamin D and COVID. Joining us to discuss is internist Dr. Ken Redcross, who is the author of Bond, the 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor. Welcome to Bloom, Dr. Redcross.
Oh, thank you, Gail. It's wonderful to be here with you.
Oh, I'm so happy to have you on Bloom today. So let's talk about risk factors. What communities are at most risk right now for COVID, and what should they do?
Oh gosh, guys. So, it's very challenging here, especially in the United States. So it tends to be the minority groups, African Americans, and also our Latino populations as well, which is something that you see commonly when you see something like the coronavirus affect those with chronic diseases, Gail. So this is what we're seeing. And unfortunately, that trend is kind of bearing out with the coronavirus too.
Now, is there something that's contributing to the spike in COVID-19 deaths for Black communities?
Absolutely. When you do a little bit of a deeper dive, guys, let's think about, if you go to the CDC, there's 4 disease states that we see are really affected, or that really affect patients. You're talking about diabetes, lung disease, heart disease, and obesity as well. And then when you look at the African American community, those are things that can run rampant. And when you do a deeper dive, even, Gail, you look at another thing and you see that all 4 of those disease states are associated with vitamin D deficiency. And you do a deeper dive and you later find out, Gail, that there's a lot of good studies about vitamin D that's important for your immune health, to help ward off flus and viruses, and also for your lung function and helping to manage your insulin levels. So this is how we're starting to realize, like, gosh, are we missing something here?
So how does somebody find out that they're deficient in vitamin D?
Yeah, so look, that's an important question. So look, guys, let's think about it. You get vitamin D only one of 2 ways. We get it from the sun, which is the sunshine vitamin, which you're getting a lot of, I think, down there in Florida.
Yeah.
And the only other way you get it is through your diet. But our diets are not naturally rich in vitamin D. And so you're going to have to supplement your vitamin D. So it's important that you give a call to your doctor to either, number 1, get your levels checked there. And Gail, there's also a website, thepowerofd.org, where you can order an at-home test kit. And so that way it's almost like making a house call, which I typically do, to get a test kit ordered and then get those results in.
I like that, because a lot of people might not know, and a lot of people aren't making those virtual appointments or those in-person appointments with their doctors right now. So you can actually test your levels at home.
You can. And the key with this, thepowerofd.org, is not only for you to get at-home test kit there, but when you get the results, Gail, you can actually go and put the results in, because they have a calculator there. And that calculator will also help you realize, how much should I take? And there's a lot of other good information to absorb on the website. So those are the things we need to do, is educate ourselves about the importance of vitamin D, especially now.
And I would imagine, as a doctor, it's not one patient fits all. Do you treat your patients differently? I mean, whether they're white, Black, Hispanic? I mean, I guess you would have to fine tune it.
Well, you know what? Actually, it's a good question, Gail. I actually focus on every patient as a beautiful soul, to be quite honest with you. I always talk about souls, because that's what we all are. And so I don't do anything differently with my Black patients. But what I do, everyone, is I'm a little more mindful. In other words, what I mean by that, Gail, is that if I know in my community that diabetes kind of runs rampant, or I have a population that has a lot of high blood pressure, I have to have a little different discussion to say, look, guys, I understand the diet. I understand some of the healthcare disparities that are out there. It's hard for you to sometimes get access to certain services that those who are not minority can sometimes get to. So it's a little more mindful, but not different in the way that I provide care and love to patients.
Oh, absolutely. Absolutely. Well, I have to tell you, you're definitely a breath of fresh air to hear everything that you have to offer. And the vitamin D connection with COVID is very interesting.
You know what, guys, let me tell you, there was a retrospective study in Indonesia. And this study showed that those who had levels that were 19 or lower in their vitamin D was associated with a 100% mortality rate. Now, on the flip side, Gail, those who had 34 or higher on their vitamin D, there were 0. There were 0. Now, all of that is not to say that everyone that the treatment is vitamin D for the coronavirus, because we know we're not dealing with the treatment yet. We're working on that. But we do know that vitamin D can be quite supportive, especially for your immune system and all the things that we talked about today just so far.
Very interesting. All right. I know folks are going to be wanting to find out more about this testing. So for more information to get your vitamin D test, you can visit the website powerofd.org. And thank you so much, Dr. Redcross.
And one more thing I want to say before everyone goes, I want to make sure that this fall, I want to issue a challenge to all of you. Get your vitamin D levels checked. Mine is 65, Gail. I want everyone to email me and let me know what their vitamin D levels are as well.
Okay, I'm going to definitely do the test as well. I'm going to log on to your website. I'm very interested in your book as well. So I definitely want to find out because I've had issues with my vitamin D levels.
I remember you mentioning that. And don't forget, Gail, the goal is between 40 and 60. That's the sweet spot for our vitamin D levels, everyone.
Awesome. All right. Thank you, doctor. We're going to be back with more Bloom right after this.
Thank you.